Hi, everybody. Welcome to Pathophysiology. My name is Tim, and I'm going to be the facilitator for this class. And just give you a background on this class. About 10 years ago, myself and another nursing instructor decided that we thought it would be a good idea to put a class like this together. So about 10 years ago, that's what we did. And for the most part, it's been pretty well received. Now, look, I'm a nurse, so I've been through nursing school, and the bottom line is this. All nursing schools are basically run the same, the clinical portion anyways. And basically it's a boot camp, right? They throw all this stuff at you and then hoping the ones who survive, right, the ones that don't drown in it, are the ones that are going to become nurses. So this class is not designed to be punitive, meaning it's not designed to hurt you. It's designed to help you. And as I've been an instructor here for 17 years, and what I've found is the reason students struggle in clinical is they don't really understand what's happening in the body. And more importantly, they don't understand some basic fundamental principles of the body. And what I'm going to try and do is I'm going to try to explain those to you and drill those into your head. And if you understand them, I guarantee that your time in clinical it's going to be better. It has to be better. I run a wellness program. I've been doing it now for 26 years in a company in Chicago. And every day, the stuff that I'm going to try to explain to you, and we're going to go over, I use every single day in terms of how I make a decision when a person asks me a question. So that's what I'm going to try and do for you. Now, look, I can do it for you. I can put it out there. But if you ain't willing to drink the Kool-Aid, there's nothing I can do for you. And you can't treat these classes, these science classes and these nursing classes like other classes. And I'm sure you're well aware of that. What you need to do is you need to be on this all the time. This is not a sometime thing. It's an all the time thing. And if you're going to get through that nursing program, you're going to have to begin to adjust your life where school is a priority. You have your family, your religion, your job. And now in this case, it's pathophysiology at Gateway Technical College. Now, look, here's the other thing. This is a 7-week course. So it's going to be labor intensive. And the unfortunate thing is the devil is in the details, and the details are what I want. Because if you understand those details, you can begin to predict things. And when you can begin to predict things, that is powerful. You don't become scared anymore. You know, look, when I started out as a nurse, I graduated and I got a job in the CVICU at St. Luke's. 22-year-old little booger picker, I was an idiot. And I would throw up every night before I went to work because I thought, is tonight the night that I'm going to kill somebody because I don't know enough? And it was a terrible feeling. And to be perfectly frank, that's what propelled me to go back to graduate school because I knew I didn't know this. And here's the thing. I was a good student. I did well, right? But I was kind of like you guys. And I get it. I get it. I was there. You're going to need to know this. It's just that simple. And I don't know what else to say about that. But know this. I'm here to help you. So if you need help, don't wait till the 5th week and you got a 23% going into the final. right? To ask for help. If you don't know what's going on, do your due diligence. First of all, I'm going to lay this class out where you should know exactly what's going on. And if you don't, then it ain't on me, because people have been successful in this course. And you need to start getting used to being self-motivated and working hard, because that's what they're going to expect. All right, enough of that. Now look, pathophysiology. Break it down for you. Path, disease. Physiology, right? The physiology. Nurses deal with the physiology. It's nice that you know where the acetabulum is. You got me? It's really nice. But nobody ever died because you didn't know where the acetabulum was. People die because you don't know what pH is. People die because you don't know what an electrolyte is and how the imbalances of electrolytes affect the body. That's how people die. So nurses, for the most part, deal with the physiology, how the body works. And that's what I'm going to try to explain to you. All right? Now, look, it's 7 weeks. You can either learn a little bit about a lot of stuff, which in my mind is not very helpful, or you can learn a lot of bit about a few things. Now watch. If you work in an orthopedic unit, right, you don't, as a nursing student, you didn't deal with a lot of orthopedic problems. But I'm guaranteed that if a little old lady from Pasadena comes in with a broken hip and she gets a hip replacement and you're taking care of her, she's probably got other stuff going on, namely cardiovascular disease, potentially cancer, respiratory disease, and almost invariably metabolic disease, right? Diabetes. So as a nurse, first starting out, you're going to deal with a lot of different diseases, but I can almost guarantee you that every one of those other people are going to have some type of comorbidity or another illness that's associated with the illness they're in the hospital for. So that's why we're going to concentrate on cardiovascular disease, cancer, respiratory disease, and metabolic disease. And 75% of us sitting, in a classroom or driving on the road, they're going to die from those classes of disease. So that's what we're going to focus on. Now look, just a couple of other things. Watch. Health isn't black and white. You ain't perfectly healthy and you ain't perfectly sick. I'll take that back. If you're perfectly sick, you're dead. But I digress. So people fall into this continuum, right? This little line here, and you fall someplace on this line. You are falling between basically healthy and basically sick, right? So what we want to figure out is, are you basically healthy and are you basically sick or basically sick? Now, look, this is important. A disease, and how I like to say it, is dis-ease. If you're not at ease, your body is stressed. And when you are stressed, your body goes into survival mode. So that's very important that you understand that. So disease, by definition, is an alteration in homeostatic mechanisms of the body that produce a negative effect on the body. And you should know this: chronic disease and acute. Acute is a situation or a condition that is usually less than 6 months, right? And then chronic is a disease that lasts greater than 6 months and it doesn't get better over time, right? CHF, that's a classic example. Rheumatoid arthritis, lupus, I can go on. Those are examples of chronic diseases. Now, another thing you need to understand, syndrome, right? A syndrome is a group of symptoms that can be caused by a particular disease. Now, look, CHF is an example of one. CHF is a group of symptoms that cause your heart not to be able to pump real good. Now, it can be caused by a lot of different things, but you're going to produce the same type of symptoms, right? So a heart attack can cause CHF, valve problems can cause CHF, being exposed to bacteria can cause CHF, and Down syndrome and AIDS, the same thing. It will produce a similar group of symptoms, but the cause can be different. That's a syndrome. Now, classifications of disease, and these vary, but what I want you to understand is, and these are very generic, very general classifications of disease, and there's basically 5 of them. You got congenital and heredity, right? Heredity deals with DNA. So if you got a gene that causes breast cancer, right, the BRCA1, BRCA2 gene, you can live a wonderful life. You can read the textbook, not go on Facebook or Twitter, right? No drinking, smoking, swearing, none of that. But because you have the gene that will spontaneously mutate, you're going to end up with breast cancer. So that relates to your DNA. Congenital means it's present at birth. So this can be, congenital can be a problem with DNA. It can be, but this is a condition that is present at birth. An example would be like cleft palate or spina bifida, right? So congenital, the problem is present at birth. Heredity, some of those problems can be present at birth, but not necessarily, right? A little baby girl isn't born with breast cancer, but they can still carry the gene that can cause that. Now, inflammatory is a huge group. Inflammatory, just a huge group. And the bottom line is this: every disease of your body starts out with inflammation. So the key to starting disease is inflammation. And I'll explain more about that later. And then you have degenerative. Degenerative means that it gets worse over time, right? And it's through repetitive damage. So watch, if you're a construction worker and you're right-handed, you can get arthritis in your shoulder, elbow, wrist of your right arm. Why? Because it's repetitive, right? And it gets worse over time. And then you have metabolic. And metabolic, there's a bunch of them, but the ones that we're going to talk about and the ones that you're going to need to understand really are diabetes, right? And some of the other hormonal issues. So metabolic diabetes is not a disease of blood sugar. It's a disease of metabolism. Diabetes affects every aspect of metabolism, and it's very important that you understand that. And then neoplastic, and for those of you who have taken medical terminology, neo means new, plastic, right, or plasia means growth, so new growth. So neoplastic disease deals with cancer, right? Cancer and tumors, right? So you can have a tumor, it doesn't mean you have cancer. And when you watch the video on cancer, I'll explain more about that. Now look, watch. Most of you have been to a doctor, you get a new doctor, right? And then the first time you're going to see him or her, you got to fill out this 950-page health history. And the reason for that is doctors are looking for these things called risk factors. Risk factors, by definition, are conditions or situations that make a person have a greater likelihood of developing a particular illness. Watch. Smoking increases your risk for lung cancer. That's a risk factor. So what doctors want to do when you first come in for a comprehensive physical is they want to assess your risk for a particular disease. So they're going to be asking you a lot of questions. You think, well, gee whiz, why does a doctor need to know that? The answer is they're assessing your risk for a particular disease. And probably the biggest risk factor for the development of disease is heredity, genes. What your mom and dad died of or will die of is probably what you're going to die of. That's why they always ask you about your family history, heart disease, cancer, respiratory disease, things along those lines, because heredity genes are a huge component of what type of disease you're ultimately going to die from. Now, that doesn't mean you're necessarily going to die if your father had colon cancer. It doesn't mean you're going to die from it, but your risk is greater. Now watch, if your father died from colon cancer at 95, well, then your risk for colon cancer isn't necessarily higher. So if your father was 55 when they die from colon cancer, then your risk is greater. So age is an independent risk factor for literally all diseases. The older you get, the more likely you're going to get a disease. And know this too. The 3 most expensive days of your life in terms of your health care are your last 3 days, right? Because you're going downhill, so they're trying to save your life, so they're doing a lot of stuff to you. All right, so risk factors. Now look, once a doctor identifies risk factors for disease, right? So you smoke, drink, swear, and again, you don't read. So what they're going to do is they're going to do a health history on you, right? And then based on the health history, they're going to identify risk factors. Now, and based on those risk factors, right, those identified risk factors, smoking, drinking, not exercising, those 3 increase your risk for cardiovascular disease, heart disease. Based on those identified risk factors, then a doctor is going to do screening tests. Right? Now, screening tests are designed to look at people who have risk factors for a particular disease and then determine, well, gee whiz, do they have the disease based on the screening tests? Now, you need to know this. Screening tests, hang on. So if you're going to screen for disease, right, based on that, on the findings on the medical history and the physical exam, right, a physician's going to identify those risk factors. And based on that, those risk factors identified, they can do these screening tests to RO means rule out active disease or to develop a plan to reduce those risk factors, right? So what makes a good screening test? Watch. Number 1, it has to be accurate, right? If it isn't accurate, what good is it, right? Back in my day, they had the old tests with the poop cards where you watch your diet for like 3 or 4 days, then You poop, you scoop a little, and then you rub it on the cards, and they would send it to be developed. Well, that thing wasn't really accurate, so they don't use them anymore. Now, the other thing is that it has to be relatively inexpensive, right? So watch. Insurance companies ain't going to pay $25,000 for you to have a total body CAT scan to look for cancer. They're not going to pay that. That's why you can't get it unless you want to pay for it out of pocket. So it's got to be inexpensive. And the test has to be relatively non-invasive, right? Watch. If somebody has risk factors for heart disease, you're not going to do an angiogram on every one. Wouldn't make sense. First of all, it's extremely invasive and the risk goes up, right? You're cutting into somebody's arteries and sticking a big wire and a catheter into their heart. So people just don't go from a visit to their doctor to get an angiogram. In between that time, they're going to do some other less invasive testing. And if those tests are positive, then they're going to move to more invasive. So it's always least invasive test to most invasive. Now, here's the other thing. Invasive tests tend to be more accurate. But again, the cost is prohibitive and the risk is higher. So going to do these least invasive tests, least expensive. And then if those are positive, then you're going to go to the most invasive testing, right? Now, the other thing is that a large population should be at risk for disease. Now, let me give you an example. I don't know. Pheochromocytoma is a tumor of the adrenal gland, right? Doctors aren't going to be doing a ton of screening tests for that because a large population isn't at risk. Who's at a large population? What would be a disease? Cardiovascular disease, respiratory disease, cancer. That's why we're covering this stuff. So the diseases that are most prevalent, those are the ones that they're going to screen for. Now, if a screening test is positive, again, you're going to start going to more invasive testing. And in this case, if a screening test is positive, let's say, for example, right, you had risk factors for heart disease, right? You had elevated cholesterol. We'll talk about this stuff, right? You had high blood pressure, and you had a family history of heart disease. Then if the screening test would be positive, for example, they did a stress test on you. If that's positive, that means that test shows that you probably got some cholesterol buildup in your arteries, then they're going to move to diagnostic testing. And diagnostic testing is more invasive. And those diagnostic testings can include lab work, right? It can include a stress test with imaging and looking inside the body, right? Endoscopy, and then ultrasounds. Now, these tests, again, they're not completely definitive, but they're much better than screening tests. And the reason they're better is because they tend to be a little more invasive. And we'll talk about these as we move through the semester. One of the things I do want to point out is this. Now look, how can lab work determine if you have a disease? Well, watch. You're going to see this a lot, so you might as well get used to it. Because know this, everything happens at the level of the cell. So what you're seeing here is a capillary which is one cell membrane thick, and a cell membrane, which is one cell membrane thick, and I'm going to call this a liver cell. You got me? Now watch. When they draw your blood, you're not going to believe this. When they stick a needle in your blood, that's a needle. They're looking at stuff that's in the blood. You got me? They're not looking at stuff that's inside the cell. They're looking at stuff that's in the blood. Now watch. In order for a liver cell to do liver stuff, it has to have specific enzymes. Enzymes are proteins that control all the chemical reactions inside a cell. So it has to have specific enzymes. And those specific enzymes in a liver cell are, you're not going to believe this, are called liver enzymes. Where do liver enzymes live? They live in a liver cell. And if the liver cell is good, the cell membrane is going to wrap up those liver enzymes and they're going to stay inside a liver cell. So if a doctor thinks you got problems with your liver and they draw blood, where are the liver enzymes if your liver cell is healthy? They're inside the liver cell. What do they look at when they draw your blood? They look at the stuff that's in the blood. So if a liver cell is healthy, they shouldn't find a lot of liver enzymes in the blood. But if you smoke, drink, swear, and don't read the textbook, alcohol, drugs damage liver cells. And when liver cells are damaged, destroyed, the cell membrane ruptures. And those liver enzymes that used to be inside the liver cell now go into the blood. So a doctor, based on testing stuff in the blood, can determine if organs of your body are jacked up or not. And now you're also not going to believe this. The higher the amount of liver enzymes in the blood, the more your liver is damaged. So that's how a doctor can say, look, your liver's really messed up. Or, look, you got a little problem with your liver. Maybe you should study more, watch more videos, and I don't know. Well, you know, don't drink and stuff or swear. That can elevate your liver enzymes. Tell me you followed that. Now watch, because there's a lot of real smart people out there, a lot smarter than I am. They found out the different types of proteins that are inside specific cells. And if those cells are healthy, you shouldn't find them in your blood. But if those particular cells are damaged, because those smart people figured out these specific proteins that are in each type of cell, those will go into the blood when those cells are damaged. Let me give you another example. Watch. Watch. Are you watching? So look. We'll learn about this. This is a heart cell. How do you know it's a heart cell? I said and wrote it's a heart cell. There are specific proteins and enzymes inside a heart cell. Two of them are troponin I and troponin T. Okay, when they draw your blood, what do they check for? Stuff that's in your blood. That's a needle, by the way. So if your heart cells are doing good, where's the troponin I and troponin T? Inside a heart cell. So when they draw your blood, if the doctor thinks something's wrong with your heart, they shouldn't find a lot of troponin I or troponin T inside the blood. But if you had a grabber, right, and the heart cells begin to die, the heart cell membrane ruptures and the troponin I and troponin T go into the blood. And you're not going to believe this again. The higher the troponin I and troponin T, the bigger your heart attack was. That's how a doctor could say, look, grandma just had a little heart attack, or oops, grandma is having the big one. You better go in there and say bye to grandma. Tell me you followed that. That's really important that you understand that. So that's how blood tests work to assess whether or not an organ is damaged. Now, look, once you've screened for disease and then the screening tests come up positive, then you do diagnostic testing. And if that is positive, then you have to give the person a diagnosis. And a diagnosis is the identification of the disease, right? What is it? CHF, cancer, right? Hypoplastic left ventricle. Yeah. Now watch. Sometimes different diseases can produce the same symptoms, right? Watch. If a person has CHF, they could have shortness of breath and a cough. Well, other things can be caused by that. So a doctor will do what's called a differential diagnosis. A differential diagnosis is, wait, we haven't completely figured it out, but it is either pneumonia or CHF. And then that patient is admitted to the hospital and further testing is done to rule out either pneumonia or CHF and find out what's really going on. So that's a differential diagnosis. Then, once you've identified the disease, then you're going to go into a treatment plan. And treatment plans fall into two phases, A and A. Yeah, that's nice. A and B. Watch, curative. Curative means that you are going to design a treatment plan that gets rid of the disease. They're going to be straight, right? Palliative means you simply treat the symptoms of the disease. Watch, if a patient is in end-stage cancer, then they may start them on TPN just to keep their strength up, but you're not going to cure the disease. So palliative means you treat the symptoms. All right, this is also important. Signs and symptoms or clinical manifestations. Clinical manifestations are broken up into basically two things, signs and symptoms. Now watch, and you're going to learn about this in the nursing program. A sign is something that you can see or you can measure. You can measure someone's temperature, blood pressure, right? You can see if they're having shortness of breath, right? You can look at them. They're labored breathing. They're cyanotic. Their belly is swollen. A symptom is what the patient tells the physician. I'm short of breath. My belly hurts. It feels swollen, right? It hurts because I can't raise my arm up. Things like that. So a sign is what you can see or measure. A symptom is what the patient tells you. Now, and based on those signs and symptoms, that leads a physician to determine what disease is going on. And look, and I'll tell you this, you can ask any physician and they'll say, yep, Timmy's right on. The single best tool a physician has for diagnosing and treating disease is a comprehensive medical history. It's the best tool they have. And that's why if you're a good physician, you spend a lot of time on that first physical when you first meet the patient, and you go through all the systems and you're asking all the questions. That's why they have to spend 45 minutes, an hour, sometimes longer as people get older. Because that first initial visit, they're assessing your baseline health. And that's important. Even, FYI, if you don't have a doctor, it's important to get a doctor and then go in for a physical, because when that doctor knows you, they're going to know your history. And a lot of times, if you got something that's really, really simple, right? You got maybe a little sinus infection. Because the doctor knows you, they're more likely to prescribe something over the phone versus having to go in and see them. That's why routinely following up with your doctor is important for patients, and it's important for you too. So study pathophysiology at Gateway Technical College and get a doctor. All right, you should write that down. All right, now look. One of the things I want to show you is this. You should know different types of diseases that fall into each classification. I kind of gave you these, right? Watch. Congenital, again, a term happens at birth, and heredity is in your genes. You're going to get it, right? If it's in your genes, you're going to develop that disease, most likely. And then inflammatory, right? And those there's tons of them, right? Rheumatoid arthritis, osteoarthritis. Rheumatoid arthritis is autoimmune, where your own immune system attacks your joints and destroys it. So how you differentiate rheumatoid from osteo is rheumatoid arthritis that happens at a very early age, right? Some kids as young as 3 years old can develop rheumatoid arthritis. And it affects both sides of the body equally, where someone with osteoarthritis, it's going to affect one side of the body more based on use and degeneration over time. So osteoarthritis is an example of a degenerative disease, right? And all diseases that I explained to you before could be described as inflammatory. And then metabolic, right? Diabetes, phenylketonuria, PKU, right? Graves' disease, Hashimoto's disease, Cushing's disease, Addison's disease. These are all examples of metabolic. And then neoplastic, really, you have cancer, and then you have these benign tumors. And when you watch the cancer video, I'm going to explain more about that. Now, so in this little introductory video, what do I want you to know? I want you to know the major classifications of disease, what a sign and symptom is, right? Why do physicians perform a comprehensive health history? What is a risk factor for a disease? And what makes a good screening test? And we covered all that in these videos today, or in this video today. All right, so I hope that helps. And I wish you luck. I really want you guys to, if you work hard, I guarantee you that this class will help you. All right, so good luck. And if you like this video, then study, okay? That would make me very happy. And you too. All right, I'll see you.